Good afternoon. So today I'm going to show how we can enhance the appearance of the lip. The single most important thing that we have to keep in mind as a provider and as a patient in guiding them is not to over-inject the lips. All too often I see lips that are being filled up with too much amount of filler and the lips don't look like natural lips, and that's not the purpose of doing the filler. The purpose of the filler is to create lips, enhance what you've got, and thereby create something that looks aesthetically pleasing and aesthetically correct. We're going to use a product today called Volbella, typically designed for the lip. Very soft product, flows very well. It is just 0.5 cc, a very small amount, and that works brilliantly. Again, it's a completely reversible product. If you did not like the results, inject a medication and hyaluronidase, and the product disappears completely in 24 hours. That's the best part of using this product, completely reversible. So I'm going to show how we do this. The product has got a small amount of lidocaine in it. Use a dental block to make the lips completely numb, and you can do that. Or in Tanya's case, she is using some ice and allow the area to get cold and makes it desensitized, makes the injection definitely much more comfortable. So as far as Tanya's lips are concerned, she has got a very good height. She lacks some volume in the central part across here. So primary focus is to just go ahead and enhance a little bit on each of these areas to create a more volume just in the central part across here, and a small amount on the sides on each side. But you're not going to inject anything along the lines. She doesn't want it. Plus she's got a very well defined area. The projection is pretty good. The height is pretty good. So we're going to start doing that by using the injection. All we're going to do is to go ahead and make tiny little injections. Again, the needle is very fine, and we inject a very small amount, and as I inject you can see it's already filling up slowly, and that's what you're going to do for her. As I inject, I can easily see the product filling up the area. The needle is very fine, so typically it does not produce any bleeding or any bruising. And in her case, as I mentioned to you, I'm not injecting anything within the white roll of the line, and all I've done is enhance it slightly. I've finished half the syringe. I'm going to do a little bit on the lower lip. Just enhance this area a little bit. Same on the other side, and gradually work on each side little by little to create a symmetrical appearance. We always try to leave behind a small amount of no area of filler and cross here to create a natural appearance. And that's all we're going to do. And as you can see, I am going to create a little bit more symmetry across here, and there it is. We create a lip that looks natural, not overfilled, and certainly not looking anything that aesthetically not pleasing. We're going to go ahead and clean this area with some bacitracin ointment. At this point, as you look from the front and you look from the side, the lip is not overfilled. It looks natural. Should never draw attention to it. That's the purpose of the lip augmentation with the filler. Thank you very much for listening to me. Bye.